Hello and welcome to a new episode of 𝗘𝗺𝗀𝗀 podcast. I'm 𝗘𝗺𝗶𝗀𝗀𝗀. I'm Family Medicine Consultant at Emirates Hospital Group. Today it's a great pleasure to have our Medical Director, Dr. Raoof. The episode is going to be different from usual. We're going to talk more management. We're going to talk more ethics. We're going to talk more quality. Dr. Raoof.
Thank you for hosting me, Wael. It's a pleasure to be here, join you for this podcast. I'm a consultant anesthetist as my clinical background. Currently, I am the medical director of the Emirates Specialty Hospital, and I'm very, very happy to be with you here today.
It's a great pleasure to have you here. And as my boss, I'm going to try my best to behave, but at the same time, I'm going to put you on the spot today.
Sure.
Ready? Good.
I'm ready.
So let's start straight to the point. Medical director. What is the role of a medical director for the people listening who don't know behind the scene, and what do you do exactly?
Thank you for asking me this question and bring this topic up for the public. It's the medical director is the central point for all connections in the hospital. The medical director has many duties and roles to play in the hospital. Mainly, if I want to summarize it in a couple of words, is to ensure safety and quality treatment that the patients are receiving in the hospital. There are many documents, like from the DHA, the role of the medical director. There are 10-20 pages describing the role of the medical director, but this is the main role. The medical director is basically the point of the bridge that connects administration to the medical staff. And during his presence in the hospital, he needs to ensure that everything is being done according to the standards policies. The standard and policies, we are governed by two sets of policies. The first of all, we need to make sure that we are practicing according to the regulations set by the regulating body, that is in Dubai is the Dubai Health Authority. And internationally, as set by the Joint Commission, as our hospital is accredited by the Joint Commission International. So my role is to basically, it's a teamwork, it's not a single man work, to make sure that all the standards and policies is being followed accurately by the physicians, and all these policies and standards are set to serve the patients and to ensure that quality care is given to the patient.
You made it sound very simple, but I'm sure it's a much more complicated role. So thank you for that short summary. Now, obviously, it's not the same, because you mentioned medical director of the hospital. We see that there are medical directors in the clinic. So there's a big difference between these different hospital or clinic settings, correct?
The DHA regulation demand that the presence of a medical director in every clinic or in every health facility. Obviously, the role of the medical director in the hospital is much different from the clinic, being a multi-specialty delivered care. And for example, in our hospital, in Emirates Specialty, we have all the basic medical specialties, the surgical and medical. And the medical director needs to work with all these physicians and all these departments to ensure that the quality of care is delivered. Obviously, it's very different when you talk, for example, to the department of, I'll say, radiology, than talking to the department of surgery or department of medicine. The role of the department is different, the need is different, and the service provided is different to the patient. So the role of the medical director is to communicate with with the departments according to the service that they are providing to the patients.
Fair enough. Now, you mentioned you're a consultant anesthetist. You're a basically medical doctor background, of course, but at the same time now you're mostly doing operational. The way I say it sometimes, like there are two hats. You have to change your hat. You have to think as a doctor, but also you think as a director. There must be clash. There must be clash between your operational, how we operate things as a medical director from a purely management point of view, but also from ensuring patient quality and patient care. How do you manage this?
True. I'll give you an example. And my job as a medical director evolved over the last 10 or 12 years. My first role as a medical director, I was a consultant in the hospital, and then I was promoted to be a medical director. So I have to change my seat from that side of the table to this side of the table. And now it's difficult, more or less challenging, to talk to a colleague in an authoritative way. Yesterday, you were sitting having lunch together. We still have lunch together, no problem. The relation will remain the same, but the role is different. But when you come to a hospital from day one, you are the medical director. That makes things a little bit smoother and easier because everybody knows that you have administrative role to play and they communicate with you accordingly. Actually, over the last maybe 10, 15 years, I was always determined not to leave my clinical practice. And when you are on the ground with the nurses, with the doctors, serving the patient, doing the work yourself, that will expose you to everything. You know if there are deficiencies in materials, you know if there are deficiencies in medications, and that's helped you a lot. When you go back to your office as an administrator, this will help you to sort out all those problems. So I think, to me, it's very important for the medical director to be practice his specialty at the same time.
So you're still one of us, basically.
Absolutely.
Very
one
good.
of you.
Okay.
Absolutely.
And the goal is always the same. We want to ensure quality because at the end of the day, what we want to provide is quality care and effective and cost-effective at the same time. So talking of that, how do you ensure quality? What are the measurements that you as a medical director, you're supervising or you're kind of keeping an eye to ensure quality care is implemented?
Very interesting question. I remember the first day I joined in one of the hospitals and I was meeting the head of the department as a consultant anesthetist, and he gave me 3 piles of files. To read, I can get a PhD if I read all those files. However, he said, these are the standards, you need to go through it. And I opened the first page and they said, operating room is a room that is dedicated to perform surgeries in it. So I thought that's all rubbish. I'm not going to read this. The real challenge is that people sit in their offices and put rules and standards. The real challenge is how do you transform these pages into practice and into reality. This is the challenging bit. However, talking about quality of patient, I've been through the whole journey of accreditation, which is new to this country. I've attended the first JCI survey that happens in this country. I was part of it. To be honest, the first years, everybody was talking about this in a cynical way because it's a new culture to this part of the world. And Dubai, it's a multicultural and the diversity of cultural diversity. Everybody is coming from a different background, from a different school. And when you want to put them all in one pot, this is the challenging bit. And so back to the quality issues. The quality in Dubai has evolved over the last 20 years. As I said, when 20 years ago, everybody is talking in a cynical way about the quality measures. Now, in 5-6 year times, everybody start talking a quality language. I call it a quality language. The nurses, the staff, the doctors, they start knowing that, listen, this is not the way how we should practice. We need to practice in a way to fulfill these standards and policies that's been put on. I was actually invited one day to give a talk about quality by one of my friends in another hospital. And he said, I want the session to be interactive. He was the medical director of a small hospital. So I said, just tell me, who's your nurse? He said, that lady. So during my presentation, I went to her and asked her if I will not mention the name, if Dr. A has come to you and wanted to do something which is clearly against the policy and the procedure of the hospital, what would you do? Doctor, I will not allow him to do so. I said, but he's the medical director. So she was a little bit confused what to say. I said, you should say, I will not allow him to do that, regardless whether he's a medical director or not. The rules and policies has to be followed because these rules and policies are set up by the hospital. They set up by an international accreditation bodies and by the DHA as well, by the Dubai Health Authority. And this is all to come and serve the patients and the quality of care that is delivered to the patients. And by the way, I really congratulate the Department of Health, the Dubai Health Authority, for setting up a really very high standard for medical practice in this country. Quite often we get annoyed, we get angry, this is an over-regulation, but at the end of the day, it really makes a difference. It makes a difference. Also, the situation in Dubai is different from other countries because we have doctors, nurses, medical practitioners coming from all around the world. In one hospital, there's about 36 different nationalities. And the usual thing I used to hear as a medical director, doctor, in my country, I used to do this. In my country, we used to do this. I said, listen, we have doctors coming from North America, from Europe, from Australia, from Asia, from all around the world. If everybody going to practice according to his or her, what she is or what he is used to do, we will end by a complete chaos. The way to do it is that please join the flow, join the system, do things as it has to be done by, according to the hospital rules and regulation. However, if you have any suggestions that things can be done better, we have a mechanism for that. We have meetings, we have committees. Propose it and we will discuss it. If it is suitable, we will adapt it. So that's the way. And the quality also, and one of the things in medicine, there is something called morbidity and mortality. So there is something, every hospital now is collecting data about incidents report, about patient complaints. And some of the meetings in the hospital of the committees are geared to discuss medical problems. For non-medical people, the Morbidity and Mortality Committee meeting is a meeting that happens regularly in any hospital. All the complications, all the mishaps that happened during for example, last week or last month are being studied carefully and discussed, and we see where are the loopholes. What can we do better? And the most important thing is that we should not adapt a punitive approach to that. Sometimes if a nurse did something wrong or the doctors did something that not according to the standards, they feel a little bit that they are very defensive. Oh, I did that. The whole thing is not punitive. The whole thing is basically, what have we done wrong that harmed the patient? What can we do to change our practice to prevent this thing happening in the future? That's the whole thing. Incidents, for example, patients coming and complain. And this was a real eye-opener to see what are we doing wrong in the hospital. So these things are, we have sources or resources of assuring that we are doing things properly. And if we are doing things not properly, how we can correct the situation and do it properly.
I mean, the topic of quality, I know like it's not something we can talk about in a few minutes, but thank you again. I mean, that was very concise. And I think the way I describe morbidity and mortality, it's a self-reflective exercise. It's always good because as humans, we make innocent mistakes, and sometimes it's good to reflect on our behavior and learn from our colleagues. And as the kind of the conductor of the orchestra, you're there to make sure that everyone is kind of operating within those standards. Which brings me now to the second question, which is maybe slightly different from quality, but still under the same umbrella, which is teamwork. You mentioned the diversity in the hospital. You mentioned the diversity of the nationalities. It's not easy. The language we talk is very different from each other, not only the cultural background. How do you manage all of that? And I'll say, I mean, doctors are always kind of accused of having, or some doctors might be accused of saying like, okay, the ego could be an issue, managing people's ego, manage people's experience, and then making sure the team captain, that the team is working together. How is that possible, and what's your secret?
My secret is that to deal with the person, you need to understand his personality. If we have 100 doctors in the hospital, they're different personalities, they're different backgrounds, their priority is different. And I talk to every single physician the way I need to talk to him, depending on understanding his priorities and his personality. This is even, I mean, not only about the diversity, even can be reflected on the patients as well. For example, you're a family physician consultant, you practice probably, you're doing more clinical work than me. Every single doctor I interview or I meet for a recruitment purpose, I tell him that in your clinic, if you have 20 patients, 5 patients may be European, highly educated Westerners, and they think in a very Western way. Some of them, other 5 is coming from different countries, from Middle East, some from Asian, some from are very lay people from villages here. So the art here is to know how to communicate with the patient in a language that he will understand. Just as an example, for example, maybe the European Western patient, they are used to they want the doctor to tell them every single thing. While some of the lay people here and some of the families here, they don't want their beloved one who's going under surgery to know what we're doing for him. I mean, just as an example, one day I was taking a patient to the operating room for a craniotomy. That is for a brain tumor. And his sons are insisting that I should not, he should not know that he's going for such surgery. Just tell him that we're going to take an X-ray, which is, of course, is not a reasonable approach. Regarding the staff, I think there is something called introduction period for every staff. As I said, because of the diversity, and usually these nurses and doctors, they are subjected to what we call it an orientation program. How long the orientation program is different from one place to another, but usually the HR department is responsible for that. And during the first week, they will educate. They will educate the nurses about their policies, procedure of the hospital, what they need to do and what they cannot do. So eventually, it will work, and it make a difference if the person is coming from Dubai, from another hospital in Dubai. They usually know everything, or is coming the first time in this country. They need more orientation.
Fair enough. So there are so many topics I want to discuss. So I'm sorry I keep jumping from one topic to another. So from teamwork, I'm going to move to a very sensitive topic. We try to practice medicine in a transparent way. We do our best, but unfortunately, sometimes there are patients' complaints. Some complaints might be a bit maybe exaggerated, but some complaints, of course, are valuable, are important for us, like I said earlier, to reflect on our practice. What is the approach? And this is, again, for the audience listening there. Someone submitted a complaint. What is the internal process behind the scenes? How do you address patients' complaints, and how do you proceed?
Every hospital has a complaint policy. And they take all the complaints in a very serious manner. And usually all the complaints, I know about it in one way or another through the quality department. For serious medical, there are some complaints that can be sorted by communication. The most important reason for especially patients' complaints is poor communication. If we communicate to the patient properly, if we explain the patient properly, okay, listen, I cannot give you medication now. I need to send you for an MRI scan, and this MRI need an insurance approval, and this insurance will take 3 days. They will understand. They will not expect that leaving your clinic, going straight down to the radiology department to have their MRI. So proper communication. I think the physician need to spend a little bit more time in being a little bit more comprehensive with the patient to explain to them at least the plan of the management for the next week or two or month or two. Right. So, however, in case of serious medical complaint that I find it a little bit concerning, I'm very keen to meet the patient myself. I want to listen from the patients. What is their problems? Why they were not happy with when they were seen by Dr. Weil, excuse me, to use you as an example. Now, what went wrong? And again, this is an eye-opener for us. Through the discussion, sometimes you can explain to the patient why this has happened. Sometimes you can see that the patient has actually some points to be addressed. So we try to address the problem with the patient. The first thing I tell the patient, listen, regardless what happened, the priority is your health. We want to get you well. Okay, you may be annoyed of something happening. Let's do this. Let's get you treat you properly. Then you can do what you want.
Fair enough. And I'm assuming then the DHA gets involved if it's a serious medical issue?
This is up to the patient. There is a very, again, comprehensive system that's was set up by the Dubai Health Authority, the DHA, and the patients, all patients are allowed to go and complain to the DHA. The way how the DHA will handle the complaint depends whether it's a clinical or not. If it is a clinical, as per the UAE law, it has to be investigated. So the DHA, there are certain committees in every specialty. For example, OB-GYN, orthopedics, surgery, plastic, ophthalmology, you name it. And they send the DHA will request the file from the hospital, and the hospital has 24 hours to deliver all the documentation to the DHA. The DHA will form actually they are fixed committees. The committee will interview the doctor, interview the patient, go through the medical file, and they will come with a decision whether there's something wrong has been done or not. Is there a malpractice, or this is just a side effect? According to that, then the condition will be proceeded.
Good. So again, just to reassure basically people listening, they're well looked after, whether it's at the doctor level and then at the medical director and the DHA, we're ensuring quality care, and that's really what matters.
Absolutely. Actually, next week I'm presenting a talk at the specialty hospital about the process that's been followed by the DHA regarding how to handle patients' complaint.
Looking forward.
It's it cannot be. But it's in summary, the patient's right and the doctor's right are all preserved. There will be proper investigation, interviewed, and there are 2 steps that the patient or the doctors can appeal. If you are not happy about the decision of the committee, you can appeal, and the case will go to another committee until you come to the final decision. It's a very comprehensive system.
Good. Now, I promise this is the last question because I think I tired you with all my questions.
It's all right, pleasure.
But medical sector, kind of the care and the healthcare, it's really changing. I mean, I've been a doctor 19 years, and it's already changed significantly. So many challenges, so many welcome challenges, so many difficult challenges. How do you address this as a medical director? And what are your biggest challenges?
It's very different. It's very different. Medical care is very different from what used to be. I went to London to do my training in anesthesia, and I got my first job as a senior house officer, which is the lowest grade in the specialty. I noticed something in the hospital. The hospital is a very old hospital. It was established, I remember the date, 1123.
Oh, wow.
It's a very old medical school in London. And I noticed that the operating rooms, being an anesthetist, I'm interested in the operating rooms. The operating rooms are located in the wards.
Interesting.
Say, for example, this is the OB-GYN ward, they have their operating room. This is the surgical ward, they have their operating room. And this is not right. So I asked why the operating room are spread all over the hospital. So they start laughing. They said, in the old days, this ward is the ward of the surgeon, Mr. X. This is his kingdom. So his patients stay in that ward, his operating room, he operates there. That's his whole world. And when the surgeon comes in the morning, the matron, they used to call her the matron, correct, with this dress
and the hat and all
you
of it.
see in the movies. She will put the younger nurses on 2 lines, and when they come, the surgeon will come, they all bow and say, "Good morning, Mr." So it's a very military, setup. That mentality has to be changed. Medicine is no longer practiced in that way. The doctors and the nurses cannot do what they want to do, regardless. They are governed by, as we mentioned earlier, by policies, procedure, and they need to follow. As an example, you cannot treat a patient in a way that is not approved internationally is the right. And by the DHA, they consider it as malpractice. Just based on your personal experience. You cannot use a medicine that is not licensed. You cannot perform surgery that is not according to the international standards. Because at the end of the day, when any side effects or complications happens and the patient complains, you'll be liable. So the whole thinking, the whole culture of medical practice is not the same as 20 years ago. Now the doctors and the doctors and nurses, the medical team, they play an important, main role in patients' management. However, they cannot practice freely.
Fair enough. Thank you very much. That was really enriching, and I really appreciate your time. Is there a kind of a last minute, and I know it's very hard to summarize it, but any last minute or last message you want to tell our audience?
Yeah. I want to give a final message to our audience here, is that you are lucky to be in this part of the world. The medical practice in this part of the world is very, very highly regulated to a very high standards, very well regulated. Everything is being under, surveillance, and everything is taken care of, the minor details to the major details. So be safe and just trust your doctors. Trust your doctors and you will have an excellent medical care. And thank you very much for it.
This brings our special episode today to an end. Thank you very much, Dr. Raoof. Please stay tuned for a new episode of Al Majlis podcast very soon. Thank you.
Thank you.